Thanks so much, everyone, for joining us today for the second installment in our Aging with Insight series. My name's Emma. I work here at St. Joe's Health Center Foundation. A few things I want to note before we get started. The presentation is being recorded today, and we'll be sharing that recording with you via email in the next few days. So if you do find there's info you want to revisit following the presentation, you will be receiving the recording. The chat feature is turned off. However, if you do have questions, we invite you to submit them via the Q&A, which you should see in the menu bar, whether that be at the top or bottom of your screen. So you can write your questions there, and I'll share them with Barbara and Natalie throughout the presentation. We have a few designated question periods, as well as time for questions at the end. If you prefer to ask your question personally during a Q&A, you can raise your hand and I'll unmute you if you want to ask your question directly to Barbara and Natalie. We also ask that you keep your camera off just to help with bandwidth on our end and ensure a smooth presentation. Now I'm going to turn it over to my colleague, Janine Kusma, for some brief introductory remarks. Over to you, Janine. Sorry, Janine, we don't have sound from you. Janine, do you want me to do the introductory remarks since you're having some technical difficulties on your end?
Oh, wait.
Oh.
Hold on.
There, I can hear you now. I can hear you now. Oh, no, now I can't.
Does that work?
Yes, that works.
Yay, well done. Well done, yes. As part of our Aging with Insight series, I want to welcome Barbara, Nicole Ross, and Natalie Whitney. They will share with us today their expertise on aging in place. But first, on behalf of St. Joseph Health Center Foundation, I'd like to extend our thanks and gratitude to the Slate Family Foundation, whose generosity and commitment to seniors' health has made this series possible. My name is Janine Kusma, and I am the Senior Manager of Legacy Giving at St. Joseph Health Center Foundation. I'd like to take a moment to acknowledge the land on which St. Joseph Health Center operates. This is the traditional territory of many First Peoples, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, this land remains home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississauga of the Credit. Before we begin today's presentation on aging in place, and while we give everyone a few minutes to join, I'd like to share a few St. Joe's updates with you. As you might know, the West End is one of the fastest growing, most diverse communities in Canada. And St. Joe's continues to see an increased demand, serving today over 500,000 individuals. 80% of healthcare is provided by our community hospital. As the demographics of our city are shifting, the healthcare system faces mounting pressure. The support of our donors and our community enables St. Joe's to face those pressures head on. We have one of the biggest emergency departments in Canada, and thanks to our donors, it is currently undergoing essential renovations so that we can meet increasing demands while providing our community with the best care possible. The West End also has highest concentration of people with mental illness in Toronto. At St. Joe's, we have the highest number of programs for mental health with specialists to treat children, youth, and adults. Those are just a few examples of many funded in 100% by our generous donors, including St. Joe's Society members who invested or are investing in our future by including St. Joe's in their will or estate plans. Thank you for your support, trust, and vision in an extraordinary tomorrow. But we still have so much more to do and exciting plans for the future, including continued investment in our emergency department and our mental health programs. If you like to learn more about this exciting work and our future plans, or make impactful and affordable donation in the will, I invite you to connect with me. My contact will be on the screen at the end, or you can always follow the impact our community is having at stjoes.ca. With that, I'd like to invite Barbara and Natalie to speak and to introduce themselves to you.
Well, good morning, and thank you for joining Natalie and I today for a talk around surrounding aging in place. My name is Barbara Nicole Ross. I'm a social worker. I completed my education at McMaster University in Hamilton, Ontario, specializing in the study of aging and gerontology. So I've always had a passion for this field. I started my career in the nursing home sector, now considered long-term care, and I've worked for Hamilton Health Sciences, Trillium Health Partners, and now St. Joseph's Health Center, Unity Health, all in different areas of aging in regards to geriatric mental health, geriatric medicine, and always on teams. So I greatly appreciate being here today with one of my team members, Natalie.
Good morning, everybody. My name is Natalie. I'm very excited to be here to have a chat about what it might take for you to age in place. My background is a little bit varied. I started off my social work career in the field of corrections. I then transitioned to mental health outpatient care, eventually to mental health inpatient care at St. Joe's. And I've been working most recently as a social work navigator within the geriatrics program here at St. Joe's. This is a very unique position, which I currently love. What I do is I consult on the inpatient units with the geriatricians, and I follow patients who might have complex needs into the outpatient setting. So after discharge, I see how the supports materialize for them and what sort of supports we can optimize post-discharge to make sure that our patients are well cared for after an admission to St. Joe's. So with that, brings us to our
So what does it take to age in place?
I don't have control of the slides.
What we want this to be is a conversation, and we're going to push this conversation a little bit further. Often when we speak of aging in place, we often think about, eating well, nutrition, exercising or remaining active. We think about cognitive health and brain function. And a couple of weeks ago, one of our geriatricians did a talk on brain health. But today we want to move it a little bit further, to go beyond, to talk with you in terms of conversations you should be having at this stage that helps to further yourself and your family, your care, whoever's providing care, have further knowledge, and to ensure that, whatever decisions are being made, that you have the voice and you direct those decisions. I think it's important as a care team. So whoever you consider as part of your team, whether it's the physician, your GP, your family, your friends, your circles, whatever those circles might be, it's important that whoever we hold near and dear, we have these conversations so that it's impactful in terms of our healthcare decisions going forward. Looking at what the supports are in the community to allow you to age in place, to support your aging and wherever that place may be, and some concept of your finances and recognizing the importance finances play as we age in place. So yourself as an audience, hopefully some of you have already started to put some of these things in place, and this serves to reaffirm what you've done, but also hopefully we provide some new nuggets for you as we go forward.
Let's see if we have control here. Yeah. So the first discussion we're going to be having today is to talk about healthcare decisions.
And when we talk about healthcare, we use the term advanced care planning, and that's broad because it really looks at what you as the individual want to see for yourself in the future around things surrounding your healthcare, your treatment, around things, your personal care. And a big part of aging in place is really, you need to feel secure, you need to feel safe, and you're concerned with remaining independent, and that's a huge part. So when we speak about aging in place, think about what that means to you, wherever that is, whether in your house, multiple level home, whether you're in a condo, whether you're in a bungalow, whether you're in an apartment, a retirement home, in a Toronto community housing, supportive housing, whatever that space means, that's where you see yourself aging. And I think what we hope is that we're recognizing parts of the conversations will be, that may change. This is where you want to be today, but being open and flexible to think that, you know what, as I change, wanting to remain independent, wanting to remain safe and secure, where I live may need to change, but it does not mean you're not aging in place. So, you know, you may need to move from that multi-level home to a bungalow to accommodate what your healthcare needs are, but that works for you. You may need to move from your home to a retirement home because you may no longer want to cook or do housework or take care of lawn, but then that's also where you need to be. And it's important to understand that when we have these conversations, often people hold firm to, I want to be in my home, but what does home mean? We have to redefine that sometimes. And it's really about our quality of life.
Mm-hmm. Absolutely. And I think to a certain extent, we're also making projections that might be many years in advance. So for example, if you know that you have a tight budget and at one point it might be needed for you to move into senior supportive housing through Toronto community housing, rent geared to income housing. What we know about this is the wait lists are about 10 years in length. So thinking further ahead than we might anticipate, putting our name on the wait list just in case our needs do change might be something that we're starting to percolate on at this point in time.
Because it allows you to be in a more supportive environment. Often there's senior supportive housing through Toronto community housing, but as Natalie said, there are wait lists. So that's just part of the conversation, and it's something that we should start talking about early and continue to have as we change, as life changes. And another important aspect of this is, in terms of advanced care planning, is looking at our living wills and advanced care directives. And living wills is more around, if we had a treatment decision to make, knowing sometimes some of our chronic illnesses, maybe recognizing how our health is changing, you know, what are things that I see that I would want for myself in terms of treatment? You know, what are the decisions that I would want my family members to make if I'm no longer able to make? How do I direct individuals to make the right healthcare decisions for me? So, you know, when you put things down on paper, often it holds more credence, and also it allows people to have that, to show that this is what my mom would have wanted, or what I would have wanted, my spouse would have wanted. And it takes away from the person having to make those decisions to feel that they're making the decision for you. You've expressed some of those needs. And we do not resuscitate is the, if to say you were to have a heart attack and someone called the ambulance, they came to your home, you know, we have I have it here, I don't know if people can see it, but there's an actual form that you can have completed by your family physician or any specialist in regards to your wishes with that. Do I want to be revived? And these conversations are difficult to have. I have an example of my parents when they were in their 70s, their neighbors who were in their 80s experienced such a situation in which the neighbor had a heart attack, and my parents went over to assist. And that opened up the conversation for us, because after that experience, we're able to talk about what would you want for yourself in that situation. And it's often in times, unfortunately, of bittersweetness, whether of loss of a friend or a family member, or changing our own health, our hospitalization. that we tend to be able to maybe raise those conversations so they're easier to have. So things also like end of life care, really, again, this week I had a friend whose father passed and he was at home, the family was able to be at home with him and it was a peaceful end. But part of that, sometimes we need to go to hospice or we're in hospital, or what does palliative care look like? And again, these are conversations when we're able and capable and able to drive those discussions, those are the times that we should have it. Because that gives us full autonomy in terms of what does that look like for me, and what would I want my family members, my whoever it is that's my substitute decision maker to make decisions in keeping with my values and my wishes. And the same goes for looking at areas like completing a will, completing funeral arrangements. It's not something that others cannot do for you later on, but it's something that hopefully you want to have some sort of engagement and participation in that, and it allows for moments when we've lost a loved one, that we can grieve and be in that grief and not be worried about the task that has to happen, because it's something that's already decided upon. If you have the funds to do that in advance and you have the support to be able to do that in advance.
Absolutely. So when we're thinking about these conversations to do with advanced care planning, this also brings up the question of capacity, or the capacity to make decisions. What we tend to see happening is this idea of capacity is most often questioned when somebody comes into contact with the healthcare system. So they come into contact with a hospital, they come into contact with their family physician. The way that capacity works in Ontario is that Ontario law presumes individuals are capable of making their decisions, their healthcare decisions, until it's proven that they're not capable. So in this regard, one of the things that we strive to do is respect somebody's autonomy with their decision making. A person is incapable of making a decision if they don't understand the information that's relevant to make that decision, or they don't understand the consequences of making or not making that decision, or sometimes both. Capacity isn't global and it isn't static. So what this means is that capacity for different decisions is dependent on the situation in which we're questioning capacity. So capacity to consent to a certain treatment decision in hospital, a surgery, a medication is different from somebody's capacity to be able to make a decision about where they choose to live. Their shelter decisions is different from somebody's capacity to determine what they want to wear that day. These are all different types of capacity around decision making. So capacity is not global in any sense. Capacity is also not static. So what this means is that a capacity finding at one point in time is not enduring in nature. Somebody can have capacity to make a decision at one point in the day and not have capacity later that day. An example of this might be somebody who's in hospital and they're experiencing a delirium. They might be found to not have capacity to make that decision at that point in time. But what we know about capacity is that it wavers. So somebody's delirium might improve, and throughout the course of the admission, at one point, they might regain their capacity to make decisions. So in that regard, capacity is not static and it's not global. What we want to think about in this regard is what happens if I'm found incapable of making my healthcare decisions. If I ever find myself in hospital and I have to have somebody making decisions on my behalf, thinking ahead about who we would want in that role. Under the incapacity bullet there, you can see that there's a number of different parties listed. Next of kin, power of attorney for property. We'll talk about power of attorney for property a little bit later in our finances section. Substitute decision maker, and power of attorney for personal care. So what's most important when we're thinking about aging in place and we're planning for the future is considering making a power of attorney document for personal care decisions. Power of attorney for personal care can be done independently with some forms that you get online, and you get a witness, you complete these forms, you can get it notarized. It can also be done with a lawyer to make it a more formal, paperwork. The most important thing here is For folks who may not have family members that are involved in their care, the power of attorney form would be especially helpful for them. So let's say I have family members that are living abroad. They're not easily accessible by telephone. They themselves might have issues with their own cognition and capacity. If there's somebody else that can make a healthcare decision for you, such as a friend or a neighbor, it would be important to start to think about this and put in place that paperwork for the power of attorney for personal care. This is because in Ontario, if somebody does not have a power of attorney for personal care document, what happens is when somebody's found incapable, it defaults to a hierarchy of who can make decisions on your behalf. So we're going to touch on the hierarchy in the next slide. But this is, like I mentioned, especially important if you don't have family that you can have available to make a decision on your behalf in regards to your health care.
And I find, Natalie, sometimes people are concerned because they think once I sign this piece of paper, do I lose that autonomy? And the power of attorney for personal care is only valid when that individual either says to you, yes, I want to enact this, or when you are no longer capable. So as long as you're capable, that piece of paper is just that, a piece of paper. So don't be concerned that once I sign this piece of paper, I've lost the autonomy to make healthcare decisions for myself.
Absolutely.
So we wanted to just touch briefly on the Healthcare Consent Act, which is the act in Ontario that spells out who can make decisions for you when you're no longer able. So who can consent to treatment? Because any treatment always has to be consented to, whether it's a healthcare staff, whether it's someone in the community, anything that, service that to come into your home, you always have to give consent. So the Healthcare Consent Act focuses around that, if in terms of providing consent, if you're not able, who then does that for you? And when we look at the act, I think what I want to stress first is number 10, the Office of the Public Guardian and Trustee, because again, there's always that fear there's the government body that's going to take over. The only time the Office of Public Guardian and Trustee gets involved is when there is no one. So if you're in hospital and there's a health decision to be made, if there's no family members, no friends assigned, then the hospital staff would call the Office of Public Guardian and Trustee. If we're in the community and we, interact with a senior who has no support systems, we may speak to them about putting an application in to the Office of the Public Guardian Trustee. But otherwise, as you see on the list, it's very detailed through our law that if, you're unable to make a decision for yourself, if there's an issue in regards to guardianship, then if there's no paperwork in place, you can go to the court. So if someone does not have a power of attorney, the family can go to court to apply for that. There's a consent and capacity board that often has to do with individuals living with issues of mental health, or those at times too with children and child welfare. But for our presentation, we're usually looking at number 3, assigned power of attorney for personal care that you've done for yourself. And if you have not completed a power of attorney, the law clearly spells out that if there is not a power of attorney, then your partner or your spouse makes decisions on your behalf. Your adult children would make decisions on your behalf. A brother or sister, so a relative brother or sister can make decision on your behalf. Any other relative, and again, if there is no one, we will go through the Office of the Public Guardian and Trustee. So as Natalie has mentioned, if you have good friends that know you well, know your values, your beliefs, you've talked about, your treatment, health issues that have occurred and they've been with you on that journey, it's important that you do assign power of attorney to allow them that authority to speak when you're no longer able.
At this point, Emma, I'm just wondering if there's anybody that has any questions that they've popped in the chat about healthcare.
So I don't see anything in the Q&A. So just a reminder to everyone on the call, if you do have questions, please feel free to enter them in the Q&A throughout the presentation. If anyone has a question right now, I welcome you to raise your hand. We'll just give it a couple of seconds here to see if there's any questions about what Natalie and Barbara had discussed so far. Okay, I think we're good for now. And yeah, so if you do have questions, please enter them in the Q&A.
Okay.
So further conversations in terms of the supports that's required to remain at home as we age, because part of aging in place is knowing your environment that you reside, whatever that may be, the environment may be, but recognizing, does the environment work for you? And how do you adapt that environment to allow it to work for you? So Natalie and I will look at the different levels of supports that's available in the community. And I will start with looking at what our government offers to us. And one of the programs that are in place is through, and it's OHIP Covered, is called Home and Community Care Support Services. And through Home and Community Care Support Services, it's an organization set up to allow for individuals to be able to remain at home with a certain level and degree of support. What we do find is there are limitations. So the blessing is that if you do require supports in the home, someone will call, will come out and assess, and then look at what are your healthcare needs and see if you meet certain criteria. Now, one of the services you can get through Home and Community Support Services, OHIP Covered, is a personal support worker. So if you're having challenges bathing, dressing, grooming, someone can come in the home to assist with this. Now, this is very much, there's a limitation. And often this is where some of the frustrations come in because individuals do not feel it's enough. But there is a limitation in terms of hours. So a worker would come in and assess a clinician, and you can get 1 hour a week to support with bathing. Sometimes you can get 2 hours a day, like 1 in the morning, 1 at night. Other times it could be 3 visits a week. So it just varies. Whatever your needs are, they will assess and determine that. And that there's a certain amount of hours for that. As well as an occupational therapist could come in the home, into your home, and they can do what we call a home risk safety assessment. So that's an individual that can come and look at your home, give you pointers on, assistive devices that you can use, adaptations that can be made in the home, but they will come for 1 or 2 visits, give you their recommendations. You can have a physiotherapy come in the home, similar if you're having mobility issues, and they can make recommendations and give you a home exercise. But all of these have a limitation on it. So what we often find, and we talk about later, is that what the government offers, what your family can support, Natalie will talk about the not-for-profit, private, together, it's the best optimum way of providing sort of aging in place. And some of the other programs through the ministry is tax rebates, and we'll talk about other tax rebates as we go along. But one of the ones in terms of home, if individuals are doing any home modifications, and so if you're living, I wanted to say, if you're living in Toronto community housing or a senior supported or subsidized environment, they also have the capacity to say, if your health changes, your physical abilities change, and you need to move to a more accessible unit, you can put in an application for that, a medical application to move to a more accessible unit. If you're in your home and you're looking to modify your home, for example, my parents recently, we had, after many conversations and years, recognized we're remaining in our home. And one of the things they chose to do is to modify their bathroom. And we looked at things like, do you want to put in a full shower so you can just walk in, and what is the cost of that? We looked at, lowering the tub, which was the more feasible, some people, you can lower the tub. We looked at raising the toilet seat, because again, in terms of being able to transfer, that was a challenge for my mom with her knees. So we raised the toilet seat. You can use the shower head so that it can come off the wall, so you can handhold the shower, so you can sit on a back bench, which again, the occupational therapist can come in and assess for that. Or if you have enough space, you can build in a seat in your washroom, changing the lightings, looking at the flooring. Often a lot of seniors, I find, have a lot of scatter rugs, too many pieces of rugs, and that's a falls risk. So there's many things that you can look at to do. And if you do a large renovation, there is a tax rebate through CRA to support that, because they want to support individuals remaining in their home safely, and they do have incentives for seniors. And the government, again, you can hear currently, they're looking at putting into place, I think it has come into place, a new Canadian dental care plan. And that's also for seniors. I believe it's 90,000 and under. So if you make anywhere between 70 to 90,000 as a household, within individuals as a household, you can apply to the government of Canada, you get a partial refund of your dental services. If you make under 70,000, you can get, I think, more of that dental service funded to almost all of it. You have to work with the dentists. You have to alert them that you're part of this plan, as well as to apply for it. So there's often different ministry incentives that get introduced to help support people where they are, their overall care, their physical, care, and also environmental care. So it's hopefully what we want to raise is a bit of awareness around things to keep in mind, things you should be searching for.
Mm-hmm. When we're thinking about additional supports at home, we also want to figure out ways that we can maximize the amount of support that we can get as we age. So Barbara mentioned some of the issues with home and community care. Number one, that sometimes people find the hours don't necessarily meet the needs of the person. Number two is also the scope of the tasks that can be reasonably achieved by home and community care support services, particularly personal support workers. We do encourage people to look out to their local not-for-profits and see what sort of agencies exist in their areas. In regards to the agencies that are around St. Joe's, we are very lucky. We have many good agencies. There's Storefront Humber, the Etobicoke Services for Seniors, Canes, Reconnect, Sprint, Parkdale Golden Age. We encourage folks to look at these agencies because there are often options for personal support workers and some light housekeeping supports. Oftentimes these personal support workers can operate on sliding scale. So if finances prove to be a barrier, there are different cutoffs for how much a PSW would cost based on your income. The scope of these PSWs tends to be a little bit broader than the PSWs that would be provided by the government or the ministry. So they can do more or additional tasks at home that maybe the government or ministry, personal support workers would say would be out of scope for them. But another reason why we suggest that folks look into their local not-for-profits is because there are often a whole host of supports that people don't necessarily know about that exist at these different agencies. We listed just a few of them there. The first one there being social programming. So we know as we're getting older, we really want to try and keep loneliness at bay. There are oftentimes a lot of social programming options at our local agencies. So ways to keep yourself physically active, exercise groups, things like that, but also just various engagements, social engagement activities.
Like lunch, like one of the big ones we talked about is to have lunch. Having a lunch.
A senior's lunch, yeah. The next one there is day programs. So this is the concept of adult day programs. These are generally for folks with more advanced cognitive concerns. Most often caregivers are using day programs as an option for respite. These are structured and supervised programs that are available, again, as a fee-for-service option, but most often on a sliding scale. There's also respite. So this is, PSW hours. These are PSWs that can come into your home and provide the caregiver respite. So the caregiver is able to, attend to their own care needs, their own personal care appointments, or just get some space from the individual who's requiring the care. There's also options for transportation services, seniors transportation services at these not-for-profits, oftentimes caregiver support groups, and options for seniors to volunteer as well. So finding some meaningful participation and engagement. Another thing that we recommend is looking into community health centers. So we have some great community health centers around St. Joe's. We have Davenport Perth Community Health Center. We have Lamp Community Health Center, Parkdale Queen West Community Health Center. This tends to be a one-stop shop for many different supports. So they might have primary care there, but they might also have access to individuals like Barbara and myself, social workers or caseworkers that are really able to help point people in the right direction for their various support needs and connect them to different resources in their community. The City of Toronto also has programs as well. So there's a housekeeping program called HMNS. This tends to have a really long wait list because it's the only covered or free housekeeping program in the City of Toronto for seniors. The City of Toronto also has various community centers for, recreation and leisure that are helpful to get connected to. And then there's this idea of diagnosis-specific supports. So we've listed there the Alzheimer's Society. The Alzheimer's Society is not exclusively for Alzheimer's dementia. They also provide multiple supports for multiple different types of dementia. So one of the biggest programs that they offer is called the First Link program, which provides caregivers with education and support about the various dementias. There's also the Canadian Hearing Services, Canadian National Institute for the Blind, and the last acronym there, BSOT or BSOT, is the Behavioral Support Outreach Team. So what this is for individuals who have quite advanced dementias. Sometimes they develop what's known as the behavioral and psychological symptoms of dementia. BSOT operates in multiple different areas across Toronto, across Ontario. These are outreach teams that consult with family members. They go into homes, they meet with patients, they observe the behavioral and psychological symptoms of dementia. They make recommendations, they liaise with personal support workers, they make customized support plans. They ensure that the caregiver's needs are met as well. So these supports are actually all free. So the BSOT, the Alzheimer's Society First Link, those are all free supports. And then the other supports at the not-for-profit, it depends what you're looking at. Some of them have fees associated with them. Some of them might be free. Some of them might be covered through a rebate or through subsidies.
And another part to that is looking at what the private sector offers. So often what we see in our population, again, in individuals wanting to remain at home and aging in place, is the need to hire supports in such as private cleaning services, such as getting more care. Again, what the OHIP services cover through home and community support services, they don't do overnight care. So that's one of the drawbacks. And they also don't do companionship. It's very much based on, the OHIP services is very much based on personal care and how do we support you as an individual physically, health-wise. So often the private sector will sort of pick up where the government and not-for-profit leaves off. But again, that's knowing what you can afford. So if you want to pay for overnight care, or pay for housekeeping, or pay for home, management of the lawn or the snow, because it just makes more sense. And when you pay privately, you tend to get the supports in the manner you want it to be. So I think often too, we look at that sector, but that again depends on what your budget, what that looks like, what you can afford. And again, as a team, we look at the general practitioner, your family physician being part of your team. And we know in Ontario right now, keeping and getting a family physician can be trials. A lot of physicians are retiring or leaving the province. And one of the, there's a government line called Healthcare Connect that can help people connect to family physicians, as well as the community health centers or walk-in clinics, but certainly having a physician as part of that care team in terms of knowing you and being able to assist in making decisions along the way. So you can, and if you need referrals to specialty teams like our teams, which we see geriatricians, you need a referral from a family physician. So it's often driven through the family physician in terms of what you can access. So it's so key. It's very key to connect yourself to a family practitioner.
Absolutely. Family physicians open the doors for so many of these specialty teams. So there are physicians that can come to your home if, for example, you or your loved one is housebound or bedbound. There are physicians that can come and assess and support in the homes. There's also specialists that are able to do that as well, geriatricians, geriatric psychiatrists, and there's also the regional geriatric programs. So we've linked the regional geriatric program on one of our final slides. So you're able to see where your local regional geriatric program is operating out of and how to get connected with them for the various services and supports. The last bullet point there is about other support items. So a lot of the items that we would talk about in this category are fee for service. We're going to have to pay for these things, but some of these are actually free. So the Toronto Grace Health Center is fantastic. They're a community partner with St. Joe's. They've recently implemented a number of different types of technology that are available to patients both in the health center and as they're discharging. One of these items is called the Odyssey pendant. It doubles as both a falls pendant and an option can be enabled to enact what they call a geofence. A geofence puts an alert out if somebody's ever wandering too far from their premises and can let a loved one or a caregiver know that that individual has crossed that geofence. This is something, like I mentioned, available in the health center, available in the community, and is fantastic because it currently has no fee of getting one of these Odyssey pendants. Additionally, the Toronto Grace Health Center has something called the Carry Machine. This machine supports with medication adherence. It's a way of managing medications, delivering and giving folks their medications via little sachets. And then it will prompt loved ones or caregivers if a medication dose is missed. They also have something called the passive in-home monitoring system. This is good for folks with cognitive impairment that live alone and can detect changes in environments that might be associated with falls or long lies or any concerning things that are out of the norm. So getting connected with Toronto Grace Health Center is fantastic, especially right now. These are newer programs, newer technologies that are coming out. Any healthcare provider can refer for these, a family physician, a social worker, an occupational therapist, and it's great to see what sort of supports are available in that regard. So that one, that's a free program currently. The rest of these tend to be support items that are fee for service. You're going to have to pay for these. These are things like medical alert bracelets. One issue with cognitive impairment tends to be this idea of stove safety or making sure our loved ones are cooking safely at home. There are automatic stove shutoffs. So these are pieces of equipment that can be attached to electric stoves, and when it's too hot for too long, it can shut off that burner. Another idea is this idea of lit toilet bowls. There's ways for
Sensor.
It's a sensor, so you can have a little bit more vision, seeing where you're off to in the middle of the night. I had a caregiver contact me and let me know that her mom had repeated falls exclusively in the context of trying to carry her meals from her kitchen to her dining room because she used a walker but couldn't hold the walker and her tray and her food at the same time. There's actually meal trays that clip onto walkers that are designed exclusively for this purpose. And so what this hints at is that there are items out there that have been developed to help folks age in place. It just might take a little bit of searching, a little bit of research, and a little bit of knowing where to look or who to contact to get you, pointed in the right direction in order to access some of these items.
Because there's a lot of items that will, like a lot of services, like even in-home labs or chiropody, or there's a lot of services that will come to you, even audiology to the home to test, or meal deliveries, which we'll talk about later. So there's also a lot of services out there that will do that are connected to now coming to you if that ever becomes a challenge in terms of being best supported in the community.
So Emma, maybe we'll take another break for questions if anybody has questions about supports.
We do have a couple questions. So the first one goes back to the first part of your presentation, talking around conversations with loved ones, healthcare. So the question is, what if you have more than one child and they don't agree on your set plan?
And that can be challenging. Yes, we do experience that. We do experience where individuals where their children do not agree. And legally, by law, if you've created a power of attorney, if you've chosen, let's say I'm using an example, if you have 5 children, if you've chosen 2 of those individuals to be your power of attorney, whether your power of attorney of property or power of attorney of personal care, the children who have been assigned the power of attorney, they have the ultimate say on your behalf. What we expect is that there's conversations and that they hear their siblings. But in the end, if you assign a power of attorney, those are the individuals who would eventually make that decision for you. So if there's squabbling and people are not getting along or not agreeing, it's truly really your decision. You've shared your values, your beliefs. your thoughts on your healthcare, your thoughts on, future treatment. Once you've imparted that to the individuals you've chosen as your power of attorneys, those are the individuals that have to carry out those wishes on your behalf. The other thing that can happen is, again, if you have multiple children and they're not agreeing, let's say by chance you're in the hospital, the decision has to be made and they don't agree. The hospital can involve the Office of the Public Guardian and Trustee to intervene.
Mhm.
So if there's a standoff and the individuals that you have identified as your power of attorneys, they're not agreeing, but a decision has to be made on your treatment, the hospital will involve the Office of the Public Guardian and Trustee. They would call and say, there's a family that's not agreeing, this individual needs treatment, and the Office of the Public Guardian and Trustee would get involved. Anything
Thanks,
Hope
Barbara.
that answers the question?
That's great, thank you. We have another question in the chat. Someone is asking, they're assuming that the legal details and what's being discussed is Ontario specific. How could someone find this applicable info for other provinces such as BC or Alberta?
I think,
They would have. I'm gonna say that this Canada, there's a Canada.ca. So that's one place. There's a lot of information on Canada.ca in regards to benefits from the federal level. Provincially, I think, like Ontario, we have Service Ontario. We have Service Ontario. So we do have agencies that cover some of these services. So it's a matter of finding out from your particular region, what are those similar? Because they probably are. I'm thinking the name might be Service Alberta. I'm not sure, but I'm just saying, every region district would have these services. It's just a matter of connecting in the community. That might not be a clear-cut enough answer. I don't know if you want to get to that.
I don't know if there's anything too much more I can elaborate or point in the right direction. I would, suggest by starting and going online and figuring out the appropriate governmental body that has a website affiliated with, advanced care planning or decision making. If it's in regards to decision making for healthcare, you can plug in some of the keywords, power of attorney, incapacity, capacity for personal care decisions, and then find out from that particular governmental website, which direction they would point you in for that.
And even plugging in advanced care planning, it brings up information. So I think it's just going on, this is where maybe using the computer, if you have some computer savvy, would be helpful, because you can plug in keywords and it will come up for your local area.
That's great, thank you. So we'll maybe do one more question now and then we can keep going and we'll take more at the end. Who do you contact about home and community care services?
Absolutely. So the local health integrated networks, the LHINs, are who are affiliated with these home and community care support services. Everybody, depending on where they live, has their own boundaries for their LHIN. So we have the Toronto Central Home and Community Care. We have Mississauga Halton Home and Community Care. If you just typed into Google, find my LHIN, LHIN, I think it's the first hit. It'll bring you to a website where you can put your postal code in and you can find out which home and community care you fall within the geographical boundaries of. If you want to get home care services, anybody can make a referral for home care. I can call for myself and try and get assessed for home care. A family member can call on my behalf. A healthcare provider, a social worker, a family doctor can make a referral to home care. But you just want to make sure that you're contacting the right home and community care by region. If you're not, and you end up getting partway through the intake process and they put in your postal code and it happens to not be the right one, they will direct you to the correct home and community care.
Because the boundaries are defined, as Natalie said, by postal codes.
That's great, thank you. There are a few more, but I think we can save them for the end of the presentation.
You can see how far we get with finances as we chug along here.
So the next conversation that we felt is important to have is regarding your finances. And one of the questions that we had earlier in terms of power of attorney for personal care, similarly, we asked and encourage people to complete a power of attorney for property. And the power of attorney for property, like personal care, is really, again, the individual giving someone the authority to manage their finances, their property, their bills, their expenses, they're paying their rent, all these things, their mortgage, when they're no longer able to. The difference with the power of attorney for property is the day it's signed is the day that someone can execute that if they choose to. Power of attorney for personal care can only be executed when the person either directs an individual to or has been found incapable. But a power of attorney for property, the day it's signed, someone can enact it. So be very careful in terms of ensuring it's someone you trust, someone who holds your best interests at heart, someone who knows how you would make if you have, excesses of investments, someone who knows how you would invest. If you have a limited fund, someone who recognizes that. You want to ensure it's not someone that's going to take advantage, because it's day it's signed, it's legally, someone can enact it. A lot of the banks today have become quite savvy in terms of ensuring and trying to protect their individuals who have powers of attorney, to ensure that the individual themselves has remained autonomous and can make those decisions. So what we often say to people, whether whether you use a lawyer to complete a power of attorney, and that's often suggested if you have a lot of investments, you have a lot of properties, you have a lot of money, it's best to do a legal power of attorney through a lawyer. And then if you basically have your pensions, government pensions, and you're renting and you have, don't have any savings, you can do Ontario government has a booklet, and it's called the Powers of Attorney booklet. We have a copy here. We'll share that in the link, I believe, as well. And you can complete that. Again, the key piece is that there's 2 witnesses to your signature. What we do find with the Ontario booklet is that times the banks may not accept them because they're still a bit leery, like anybody could have filled this out, right? So they're not trusting always that who said they filled it out is truly that person. So they may ask you to do their own bank power of attorney. Some banks have their own power of attorney forms that they make you fill out. Some may ask you to have the government document notarized, which is still cheaper than going to a lawyer, because you have to often about $500 or more sometimes to do powers of attorneys with lawyers and wills. So, and what we suggest and always recommend is if you complete a power of attorney for property, is to take it to the bank. Take the person who's your power of attorney for property at some point to the bank, so they know who that person is. Some government pensions will ask for that power of attorney, depending if you're calling on behalf of your parent or of your spouse. They will say, the pensions will say, we need you to send us a copy of your power of attorney. So, when it comes to finances, it does get asked for. It's very hard for people just to manage other people's affairs unless they have the authority to do so. Often we'll also say to families, depending on the relationship and where you are in your level of independence, and someone you trust complicitly, assign someone as a joint on your account. So if anything happens, if your adult child is joint in your account, they're able to access that account and do what you need them to do without there being any challenges to that. So that's another way as well. And when you talk about property, it's not just managing someone's investments, et cetera, but it's ensuring their bills are paid. It's ensuring if someone progresses and needs to go to a long-term care facility, that's paid for. It's ensuring if the person needs clothing, nutrition, all those things, you want to trust that someone is going to carry out your healthcare needs as well as carry out what your values, beliefs, and desires are. And we ask individuals also to be aware of what the income sources are. So for those who have worked and paid into the Canada Pension Plan, you might have a CPP, Canada Pension Plan. If you've been working with a company that there is a pension that exists within that company, you would have your company pension. But the federal government also has old age security and guaranteed income supplements. And those are supplements based on your pensions, based on what you're getting as a senior. If you don't have any pensions, if you didn't work or did not collect enough to have a work pension plan, you can get old age security and guaranteed income supplements. And the Ontario government has gains. which is the supplement through the Ontario, the provincial government, in terms of receiving some sort of income as a senior if you don't have any. And those numbers will fluctuate, so we haven't thrown out numbers because all those will depend on what each one sort of depends on the other, what you would be receiving. So just be mindful of, you know, we're finding also a lot of seniors in regards to the economy today are working part-time, still continuing to work. So again, just be mindful if you're continuing to work, what that means for your pensions, how that affects your pensions. So it's conversations you would need to have with an accountant or with whoever manages your finances, or even calling Canada.ca and having those conversations with the staff in terms of, you know, how that might impact your pension. And there's a lot of benefits and credits through the government as well. And there's a Canada Caregiver Tax Credit. So if you are in your home and caring for a loved one, caring for your partner, you can apply for this tax credit when you complete your income tax. There's also disability tax credit certificate. So the individual who might be unwell in the home could apply for that disability tax credit, as well as the person applying for the Canada Caregiver Tax Credit. Or if you're ineligible for Canada tax credit, you can choose, the caregiver could choose to apply for the disability tax credit certificate. So there's a lot of, you know, there's a lot that's out there, it's just how you use it. So again, a medical expense tax credit, again, if you spent X amount of your income in terms of medical expenses, you can get through income tax as well, some rebate for that.
Private ambulances, funding wheelchairs, things like that.
Yeah, so anything you paid for out of pocket for your medical expenses, keep those receipts. And after a certain amount, you can use them to apply for a rebate when you do your income tax. Now, some of we have listed there, the compassionate care benefits. There are benefits through, that's for a caregiver. So an adult child, that says an adult child, you need to take time off work to care for your parents or to assisting in caring for a parent. And that's a benefit that's available to you, as well as there's benefits, like compassionate care benefits, sort of end of life. So there's a family caregiver benefit, which is time off to care for a family member. And there's a compassionate care benefit if you know your parent is at the end of life, that you can take some time off as well. That's supported through the government. So there's a lot of programs that happen. It's just often we find the challenges for people is knowing what is available. And again, search engines like Canada.ca sort of takes you always to the government website that shows a lot of what is available for people.
And I think we have linked the benefits and credits page on our resource slide there. It's worthwhile to note that there's also multiple different ways to try and get connected with these. So not the most straightforward thing. The majority of the tax credits are being filed at tax time, but the disability tax credit certificate for, you know, can be filed at any time throughout the year, and that's done with a physician. So there might be a little bit of red tape with certain benefits and credits. So all the more reason to start thinking about these things early, putting them on the radar of your accountant if you've got one, and taking a browse on those websites and seeing what might be relevant and applicable to you.
One question I often get asked is, do you get paid to be a caregiver? And the answer is no. When you're caring for a loved one, you know, as an elderly partner yourself, or even sometimes as adult children assisting in the care, there's no pay that's involved in that. But certainly there's opportunities for benefits around that.
This is our last content heavy slide here for the day. We wanted to put it on people's radar to start to think about the cost of additional care needs. So there's no clear-cut way for each person to make, you know, a budget, or there's no calculator that exists to really factor in all of these types of things. Unfortunately, everybody's situation is going to be so vastly different because they might have different medical conditions. They might be aging in place in different locations. They might be, accessing different funds based on what sort of employment history they had. They might be entitled to certain tax credits. So there's no clear-cut answer for how we can really financially plan, other than starting to take into account all of these different costs of care as we age. So we do want to encourage folks to think about issues like food security. If the task of meal prep in itself becomes too daunting, considering going to the grocery store and then cooking itself, do we want to look into options like Meals on Wheels or Heart at Home to provide ready-made meals that a personal support worker can just heat up for us? If the finances are really the issue, are we looking into food banks and food programs in our neighborhood? As we mentioned, there are seniors lunches that tend to be quite affordable. There's also the Red Cross mobile food bank for seniors. So folks that can't really leave their home to attend a traditional food bank, there is mobile food banks that can come to you. So we want to start thinking about food security and factoring that into our finances. We're also thinking about home upkeep. So there might be some folks, a lot of folks on my caseload who, at 88 years old are still shoveling snow or raking leaves, and I can't get dad to stop it, but to a certain extent, getting out there and getting active. But at one point, those tasks or those items might become, too daunting. It's too, physically draining on folks. So we're factoring in what
And
those
issues of safety and risk,
and
right?
issues
So,
of safety and risk.
yeah.
Certainly.
Yeah.
So we're factoring in those sorts of services as well. What might that cost to have somebody come to shovel your snow or do home maintenance or housekeeping like we talked about before with personal support workers? We also want to encourage folks to think about bills. There's, property taxes and utilities, those don't go away as we continue to age in place. There is subsidies and deferral programs and grants that do exist if you are a low-income senior. So we can see a couple of them there, particularly for property tax increases. There's both a cancellation and a deferral program for the tax increase. There's the homeowner's property tax grant that exists. The Low Income Energy Assistance Program, LEAP, helps people with their household utility bills. There's the water rebate and solid waste rebate programs for other bills that come into effect. So these are all dependent on income levels. So again, something to start to think about because each one has their own income cutoff. We've listed a number of other items there that we want to encourage people to start thinking about because some of these items are covered, some of these items are not covered, some of these items are covered in part or in piece. These are things like mobility aids, so walkers and wheelchairs, hearing aids, diabetic supplies, dietary supplements. So these are things like onshore meal replacements, catheter care, if you need a hospital bed at home to age in place, incontinence products. Some of these items are funded. So we've listed their ADP as an acronym. This is the Assistive Devices Program, and this is something that's accessed through home and community care. So let's say I, needed some support with figuring out how to fund one of my mobility aids. I've been, struggling with my mobility and now I need a 2-wheel walker. I can ask my representative from Home and Community Care Support Services, oftentimes a care coordinator, to send out an occupational therapist. This occupational therapist can then help me to complete the forms for the Assistive Devices Program and help for me to get funding for my mobility aid. In addition to this, we both recently found out that through the City of Toronto for low-income seniors, there is support, and for low-income folks across, age demographics, not exclusively seniors, I should say, there is support for medical items, devices, and supplies. So traditionally, or from previous knowledge, there's no coverage for incontinence products. So things like diapers and wipes, nobody's funding that. But if you are low income and you live in the City of Toronto, there is a program specifically for this. So again, trying to keep abreast of all this information is very, very challenging. And often a reason why it would be beneficial to connect with either your local geriatric clinic or your local community health center to try and get connected to a social worker or a case manager to navigate all of these different items, right?
And I was gonna say, know that something like a hearing aid, you can get, there's a through an Assisted Devices Program, if you're connected with an audiologist, they'll help you sort of that process. Even with the diabetes with seniors, if there's things you need, and this through the Assisted Devices Program, if you're connected to a diabetes clinic. So depending what the needs are, different professionals and clinicians can help you access funding through the Assisted Devices Program.
We also have a byline there about thinking ahead, avoiding fraud and scams, and protecting your finances. as we know, seniors tend to be the targets of a lot of scams and things that exist online for fraud. We want to encourage you to connect with your loved ones and be aware of, some of these types of scams that exist out there, and just be mindful, not sharing your personal health information, not sharing your banking information, not sharing information about your identity with people over the phone or, online, unless we can be absolutely sure that we can trust those individuals. The last point there is about your primary residence. So sometimes as people age in place, they do end up using their housing as leverage. So what this means is that some folks will sell their home to be able to finance their next step for aging in place. So selling their primary residence and moving to assistive living or a retirement home, or even, doing a reverse mortgage, borrowing against the home to be able to finance in-home care is also an option. So something to just kind of keep on the radar. And like we mentioned, there's no straightforward equation for how to factor all of these costs of additional care into place, but just something that we can start to percolate on as we're planning to age in place. Any other questions from about the finance section, or we kind of just have a couple slides about our summary and links?
Yeah, I think go ahead and do your summary, and then I have a couple questions in the chat that I can read to you.
So we really want to emphasize, it's really about you as the individual, your values, recognizing your need for quality of life. So maintaining your independence, and what does that look like as you age where you are, and being able to continually have conversations with your healthcare team, your family, as part of that, to ensure that people understand you and understand what your desires, your wishes, for treatment, for housing, for any aspect of your care that we talked about, finances. And part of that is to prevent burnout for caregivers and for yourselves, but also just that open communication is key to a successful aging. So aging in place, as we have on the slide, requires effective communication around your health care, willingness to recognize, seek, and accept help. Often we see from our clients, they don't want the help, but they want to remain at home. And that's kind of at odds, because in order to keep them at home, we want to provide help. That sometimes presents itself as a challenge. And building and maintaining social networks and support systems. We didn't spend a lot of time on that, but that is so key in remaining at home and healthy. And also around financial planning, recognizing what your finances are, being, seeing where what needs can be met with your level of finance, and being, I think, open with that, with those you trust, to ensure that your healthcare needs and your need as you age period gets met as best as possible.
And I think, the major thing is the openness and the flexibility and the ability to borrow or utilize services from different sectors. One thing that I realized we didn't touch upon with the personal support work is that people consider moving to a retirement home to be a huge financial burden. So they're looking for other ways to reduce costs. What people don't often realize is that you don't have to accept the personal support work hours provided by the retirement home, that you can actually request home and community care support services, provide that PSW support within the retirement home. So that cuts the cost of the personal support work, because that's covered by OHIP now instead of through the retirement home. So having some flexibility and some creative problem solving is absolutely integral to make sure that all of your needs are being met in the best way for you.
That's great. Thank you both. Natalie, can you maybe move it over? We'll have the resources up while we go through these last couple questions, just so people can look through those if they want. So I have a question I'm going to read from the chat. Considering the possibility of needing senior living with rent geared to income, as well as the long wait lists, and getting to the financial point of being eligible for these wait lists could take a few years. Then adding the possible years of waiting makes it unrealistic to ever be able to enter these rent assisted programs as a senior. How can a senior work within these realities and application restrictions?
I think the question that's being posed is that you need to be considered low income to be able to get on a wait list for low income housing, which is absolutely a huge barrier. Because you do need to provide copies of your notice of assessment, your tax forms to be able to be eligible for these services, and absolutely a gap in the system. I would suggest, first of all, linking with Toronto Community Housing and seeing if there's, other avenues for support that's not considered. But additionally, thinking about stopgaps for folks in the interim. So there are, assistive living facilities that tend to be more affordable than retirement homes. We mentioned the budget for retirement homes can start, around $4,000 a month, go to $12,000 or $15,000 a month, depending on whether or not you require a memory care unit. But some of the more assistive living facilities, for example, Fairfield Retirement Home, if you have a shared room in one of those sorts of facilities, then it tends to be more affordable, around, $3,000 a month, which we still recognize is out of the budget for, a large majority of people. In regards to bypassing wait lists or kind of, skirting issues with finances, I'm not sure if I have a clear cut answer.
Yeah, there's no bypassing waitlists, unfortunately. I know that Toronto Community Housing in the last few years have tried to clean up the waitlist by really getting to it and looking at who's still active on it and asking people to be more engaged with it, connecting every year to make sure they're still interested. And they started looking at certain decades and saying, okay, if there's anybody that's been waiting from this decade, this time period, we're going to try and get them into housing. So they themselves has recognized that it's a challenge and it's a long process, and have tried to streamline that process a bit. Some of and it may not take care of the actual cost of your where you're living, but in terms of the supports, some of the Toronto Community Housing buildings that provide support for seniors, sometimes if you live in buildings around those, like hubs, they call it, you can still be provided with support in your building, although you're not in a specific Toronto Community Housing building. But if you're within a hub, you can still receive supports. But in terms of actually getting a unit in a more timely fashion, which is what part of the question, how can we in a timely fashion? There's no real answer for that. It's just part of the housing crisis. Yeah.
Thank you.
Unfortunately.
We have another question that asks, is there any difference between a nursing home and a long-term care home?
Yeah, we can definitely speak to this. So the verbiage associated with nursing homes, or this idea of a nursing home, tends to be very American centric. In Canada, we use this interchangeably with long-term care, but that creates a lot of confusion for people. So when I'm working with clients, I recommend we just take the concept of nursing home and take it off the table, because really what we're talking about is the difference between a long-term care home and other more independent fee-for-service options for living, which is retirement homes and assisted living facilities. So nursing homes, yes, sometimes interchangeable with long-term care, but most often American-centric language.
And the long-term care is sort of we've moved away from using the terminology nursing home, because it's not, when you think nursing home, you think primarily nursing care. And I think, trying to be more holistic about it, part of the discussion had been, everything is provided there. There's therapeutic recreation, there's meals, there's spiritual care. So we've kind of moved from just looking at saying nursing home, because it connotates nursing, to what we call long-term care facilities or long-term care homes. So you'll hear that, but it's one and the same. We've just moved from saying nursing home.
And I think the idea of nursing homes also creates a little confusion, because nurses are present in so many different areas. So nurses can be present in an independent living situation. Nurses can be at an assisted living facility. They can be at a retirement home, and certainly nurses are present in long-term care as well. Yeah.
Thank you. I don't see any more questions coming in. So I guess to wrap it up, this has been such an informative presentation. And there's obviously a lot to consider when someone is starting to think about how they're going to age in place. For someone who's kind of just starting to think about that for themselves, is there a certain area you recommend as a starting point, like the first thing they should consider?
I think, like, I always feel like, as we talked about in the beginning, sort of, where is that going to take place? So as I age, where is that going to be? And as we talked about, just being open to that even changing. But I think first being able to say, where will this take place? Where do I want to be when that happens? And then, you know, in terms of your location, your environment, then from there, that will inform what community services you're able to access. You know, it informs what you can afford. So I think just knowing where you want that to happen is one of the first things to think about.
I might also suggest, checking in with your values and your preferences as being a good place to start. For example, there's a lot of seniors that we work with that say, my goal is to remain at home, independent, without care for as long as possible. Then there's other people, for example, my mom. She is happy to receive support from anybody who is willing to offer it and, has made it quite clear that as she continues to age, she would be open to receiving that help, whatever it looked like. So checking in with your own values, your own preferences for what you would like that to look like will really gear the direction about where you want to go to age in place and what that will look like.
But it's all about having conversations, because I think so often if we don't talk about it, then, it doesn't get shared and we can't and it's a continuous process. It's not one conversation. So the earlier we can start talking about what that might look like, especially when there's opportunities to do so, it's important to start that conversation.
Thank you so much. So I just want to thank everyone for all your questions and for joining us today. And I really want to thank Barbara and Natalie for this really informative presentation and taking the time. As a reminder, we will be emailing a recording out in the next couple of days. So you'll see that coming to your inbox. Also, Aging with Insight is going to return this fall. So keep an eye out on our website, support.sayjoes.ca, as well as our social channels for more information on that. I'm going to put my colleague Janine's contact info up for one more minute, just in case anyone wanted to write that down and wanted to follow up with her. Otherwise, thanks so much. Have a wonderful day, and we look forward to seeing you at the next one of these in the fall. Thanks so much, everyone.
Thank you.
Thanks, everyone.